Dr. Williams, we did talk about how periodontal disease is devastating to the body, brings the immune system down and just makes the whole body being sick, basically. Literally takes ages of your life for all purpose. Now, what is out there to fix periodontal disease, and how complicated is it? How painful is it? Because there's lots of rumors out there that, oh my God, I need a periodontal disease. It's like akin to root canal. I need a root canal, the worst thing in the world. Tell us a little bit about it. Is it really that bad? Obviously, your sedation dentistry will probably help for people who worry about it, so they won't even know you're cutting them off. But tell us a little bit of how you fix periodontal disease. What's the procedure there? What are you doing?
For periodontal disease, there's going to be two tissues that's going to be mainly affected. That's the soft tissue, the gums, and the hard tissue, which is the bone. For those patients, as we spoke earlier, that are very apprehensive, we can sedate them, and that'll get them through the procedure. When we're fixing, let's say, the soft tissue, and the person has, let's say, long teeth where the gums have receded due to whatever reason, brushing too hard, periodontal disease has destroyed the gum tissue, we can add gum tissue back to repair those recessed areas, so to speak. And that can bring back their smile, their confidence, and stabilize the tooth as well from future problems. For those patients who have bone deterioration, which is a very hard substance, the second hardest substance in the mouth, and once that bone is lost, it will not grow back on its own. So we have to go in and what we call augment or add to the bone using various mediums. We can use the patient's own bone. We can use some synthetic bone to build up the bone that's been lost. And over a period of 4 to 6 months, we'll see that bone regenerating around the teeth. The patient doesn't know that's taking place. We just take periodic x-rays, and that gives us evidence of bone regeneration. So within my practice, those are the two big treatment modalities that I do, is what's called bone augmentation and gum augmentation. We also can do non-surgical treatment to treat periodontal disease. If the patient is not in that very, very severe category, maybe it's just at the cusp of getting started, so to speak, we can go and do what's called scaling and root planing. People in the public know it as a deep cleaning. We can go and remove those hard calcium deposits off of the teeth, and that's done under local anesthetic, possibly with laughing gas, or patients say, well, I just want to do it all in one appointment. We can sedate that patient and do it all in one appointment, and they're taken care of.
Okay. So basically, when you do gum surgery, you're not really necessarily you're not taking stuff out, you're actually building stuff on it.
Yeah, we're adding back to what they're missing. So we're what's called augmenting, or adding back to the lost gum tissue from receding gums, or adding back, as I said earlier, the bone that's completely missing. With that infection there, that bone is going to be more and more infected and possibly lost over a period of time. But when we do the bone augmentation or bone grafting, we're actually building the bone back up to a state of health so that the patient can keep their teeth or tooth over a longer period of time than if they didn't have the procedure done.
And at the same time, get rid of the infection, which poisons the body.
Yeah, exactly. So not only are you helping the patient from an oral health standpoint, but you're helping them healthy from a systemic overall body health. And that's the goal, not just oral health, but total health. That's what we practice in our office, total health for the patient.
Okay. And when a person has such a gum surgery, one way or the other way, whether it means augmenting the soft tissue or the bone, and let's just say he keeps relatively well care of it thereafterwards, which he might not because he got in the first place because he doesn't. So can that be done again? You know, like heart bypass, you can only do it once or twice, and then it becomes majorly critical or not doable anymore on an average. So how is it with this surgery? You know, you do it, the guy's, let's say, 40 years old. Can it be done again at, I don't know when, but and again and again, yes, in case he doesn't take care of it?
That's correct. It can. To answer the question straightforward, the patient after a procedure, let's say 10, 15 years ago, had some type of periodontal surgery done, let's say bone grafting, and they didn't maintain it. They didn't go back and have what's called periodontal maintenance prevention therapy. Right. To keep the plaque and the build-up calcium deposits removed because they can't do it on their own. That's impossible. Then the infection is going to return, and it returns is going to destroy more bone than they originally had lost. So we can go in and do the surgery again. The key, though, to periodontal disease is the patient understanding that this infection cannot be cured. Once they can understand that, just like diabetes, it cannot be cured, it can be treated, it can be controlled, it can be maintained, but it cannot be cured, then they have to understand that they have to be seen for a lifetime for what's called periodontal maintenance, which is they come into the office and they're having that buildup removed about every 90 days or every 3 months. And that's the way we keep the infection under control. If patients don't maintain their periodontal maintenance appointments, the infection is going to come right back. They can only keep clean above the gum line, or basically what they can see in the mouth. We're going beneath the gum line where they can't get to it.
So are you telling me that even after surgery, the infection isn't really gone?
Oh, the infection is, we can say, gone, but it's not cured. Because it's a bacterial infection, remember we said that this infection spreads throughout the body. You can have the bacteria on your cheeks. You can have the bacteria on your tongue. Okay, and you cannot eradicate 100% of the bacteria. It can be systemically as well. And that bacteria can get right back into the oral cavity and start multiplying all over again. So the key is not total elimination or eradication of the bacteria, but decreasing the load of the bacteria to such a low level that your immune system can keep itself healthy. And by eradicating, you can't do, but by suppressing the bacteria, which we can do, then that allows the immune system to keep the patient healthy. And that comes through periodontal maintenance.
Mm-hmm. And that's similar to a regular cleaning, just maybe a little more detailed.
Actually, it's more thorough, more meticulous, yes. Mm-hmm. Typically, when patients talk about cleanings, we refer to as dentists, that's what's called a polish or a prophy. But when they're coming in for what's called root planing or for scaling, that's more detailed. Especially a person who's had periodontal disease, they are going to have more or less scaling debridements for the rest of their life, not just regular cleanings. That's for someone who's never had a periodontal infection. They don't need that detailed, in-depth type of cleaning, so to speak.
Got it. Okay. Well, is again, like I grew up in the mountains, and when it gets cold, and you don't run around and saying, well, it wasn't cold yesterday, so I don't want to buy a new jacket for getting cold. Well, if you don't, you freeze to death, you're finished, you're done. Right. It's kind of what it is what it is, and we need to take care of it. We should be lucky and happy and grateful that treatment is available.
Exactly. And it is available. It's up to the patient to actually understand the availability and go forward and move with it and get themselves healthy.
Yeah, well, with no doubt, I have noticed that out of all the medical arms which are out there, from cardiology to name it, just, even getting rid of a normal cold or of a stomach virus or whatever it is, there is no medical branch which has a better, more predictable curing rate than a dentist.
Sorry, repeat that again.
I said, out of all the medical branches, the dentists have the most predictable and can cure everything, where many other branches of medicines cannot say that for themselves. That doesn't make them bad, it's just how it is.
That's just the way it is, exactly. With dentistry, we've come a long ways. It used to be, person had a problem, you took out a tooth. But now with dentistry, you don't have to take out teeth. They can be treated not with silver fillings anymore, but they have the white resin fillings, root canals. With periodontal disease especially, that's the number one reason for tooth loss. Instead of taking out teeth, there's non-surgical as well as surgical treatment intervention to get it under control. And once it's under control, the patient can have their teeth for a lifetime.
Again, thank you very much, Dr. Williams. Thank you very much for your informative session here. Bye-bye.
Thank you.